to helping organizations build inclusive, thriving, and high performing environments. So, with expertise in leadership, psychological safety, organizational well being, and human resources, so she empowers leaders through research based strategies that foster belongings to sustainable success. So, that was a wonderful bio, Sherry Collins. So, you can continue with your presentation and all the best.
Wonderful. Thank you so much for the wonderful introduction. I appreciate it. All right. And my slides are not in presentation mode. Can you help me with that, John or Arjun? Hmm. Anyway, I'm going to go ahead and get started. I'm not sure if there's going to be technical difficulties on the back end, but my
Hello.
name is Sherry Collins. Yes.
Yeah, let me know what problem you're facing, Sherry.
I'm not seeing my slides in full slide. I'm just seeing a little snippet of them.
Okay, so you please press the slideshow up. So there will be
Yeah, I
button
don't
slideshow,
have
right?
yeah, I don't have the controls, unfortunately. It's all blacked
Hey,
out.
you don't have.
No. I can see it, but it is not clickable.
So you just go to the PPT once and just press the slideshow button. Yeah, and yeah, play from
Is
the
that
current
working
slide.
better?
Yes.
Okay, perfect. So my name is Sherry Collins. I'm in Omaha, Nebraska. I'm not going to do too much more of an introduction since we had a moment there of some technical difficulty. So we'll go ahead and get right into it because 25 minutes goes really, really fast. I want to start by asking you a question though. When is the last time that someone really asked you about your own well being and truly stuck around to find out the answer? I want to begin by saying I hold a certification called the Chief Wellbeing Officer certification, and I earned that through the World Happiness Academy. I met Luis, who's the owner of the World Happiness Academy, at the Gross Global Happiness Summit. And I connected with him and was able to earn this certification. And in my studying for my certification, I studied the framework that we're going to discuss today. So, just so your brain knows a little bit about what will happen in the next 25 minutes, I have a couple more questions I want to pose just to get you thinking about the topic. I have a couple statistics to share about why does this even matter? Why are we talking about it? And then most of our time today will be spent on the well-being framework. And I'll wrap up by encouraging all of you to take action. Like, hopefully, this will change some hearts and minds. And what will you do immediately after this call, or what will you do tomorrow? So here are some questions I want you to think about. The first one is, how many of us have given that work life harmony talk and then we only answer emails until 9 o'clock ourselves? I know I have been guilty of that one. Have you ever chatted with your team about self care and maybe you don't practice it fully yourself? I've also perhaps been a guilty of that. Have you ever counseled someone on boundaries when you may not hold them yourself? Setting boundaries, that's really important for our well being. And how many of you this week put on your own oxygen mask first? I've been traveling a lot this week. I've been on lots of flights this week, probably I think 8 flights this week alone. And I've heard them say this so many times, putting on your own oxygen mask first. So that takes us to, why does this matter? So just a couple statistics that I'd like to share with you. The first one, oops, it's not wanting to advance now. There we go. The first one is a study that was done by Gallup. The finality of the study happened in 2024. But the question that was asked is, does your organization care about your own well being? So here's the results to that. In 2020, almost 50% of employees said they strongly agreed with that statement, almost half. Unfortunately, in 2024, that number had dropped to 21%. So people are feeling across the world that their own organizations don't even care about their employees' well being. And statistically, from some research that Gartner did in 2024, 77% of employees expect more support at work for well being and work life harmony than they did before 2020. So you can see the dichotomy of those studies. People are wanting more and more, and they feel like they're getting less and less. So, what's a way that we can counter that research is by implementing pieces of this framework. So, I want to start by saying number one, this framework can work for an organization of one or two, and it can work for an organization of 1,000. It can also work within specific departments if you want to take this back for your department. But it can be used across any sort of organization in any industry. And I also want to say don't be overwhelmed by thinking you have to implement everything. Pick something and implement something, and then add something to that as you get ready to progress. So the full framework is comprised of these five different categories: protection from harm, connection and community, work life harmony, mattering at work, and opportunity for growth. And it's based on 10 basic needs that we have as human beings. So when we talk about each of the different arms of that framework, I will mention the two human needs that go with that one. And then in the middle, you'll see that it's all centered around worker voice and equity, two really important components that sometimes are left off when we talk about mental health and well being. I'd be remiss if I didn't give credit to where this came from. Dr. Vivek Murthy, who was the Surgeon General in the United States, the 19th and the 21st Surgeon General, his teams developed this wonderful framework that we will now jump in and discuss. So the first piece is protection from harm. It's based on the two needs we have for safety and security. And those needs are really strong with me. So one of those ways to protect us from harm is providing psychological safety. So I'm going to just give a really broad brushstroke on psychological safety. The longest training I've done on psychological safety is 6 hours. So I will cover this slide in about 60 seconds. So again, it will be just a really broad discussion of what really is psychological safety. Amy Edmondson is credited with her work in this in the 90s. And now today, she's probably the most famous person doing work in psychological safety. But Dr. Timothy Clark has developed 4 levels of psychological safety. The minimum level is inclusion safety. How are folks welcomed onto your team? And how do we give people what they need in the workplace? The next level up is learner safety. Can we learn together? Do we feel okay saying, oh, I don't know that? Is that safe? Or do you have to hide things you don't know because it's not safe to admit what you may or may not know in your teams? The next level up is contributor safety. Is it safe to even open my mouth and contribute? And then once those 3 levels are completed, your amygdala in your brain, that part of your brain that's always on high alert for danger, it can start to calm down a little bit, which allows the creative centers of your brain to take over. And that's why the next piece is called that innovation threshold. That's that piece of psychological safety where it's okay to be innovative at work and it's okay to be creative and take risks. The highest level of psych safety is challenger safety, and that's where it's safe for you to challenge the status quo. Is it okay to speak up and suggest something different, or is that not welcomed at your workplace? So, psychological safety, one way to protect us from harm. I really can't be at any workshop anymore where AI doesn't come up. And I think this is an interesting statistic about AI and psychological safety. But 80% of leaders say that psych safety boosts the success of their AI work. So, those of you that are in the business of AI, I mean, all of us are using it, most all of us for work and projects. We have to still have that psychological safety behind AI utilization. There are also specific correlations between psych safety and physical safety, and that means a 40% reduction can happen in physical workplace incidents when you have good amounts of psychological safety. So, speaking of physical safety, occupational hazards, make sure that all of those are reviewed, make sure that safety materials are in multiple languages or you have appropriate translation. And then also that emotional protection that sometimes we have in workplaces, such as when you're being gaslighted, or when you have bullying, or when you're being intentionally excluded, or if you're scapegoated for work on a project that doesn't get done. So, all of those things are pieces of safety. Another way we can protect ourselves from harm is through rest. So, check in if you are a leader on your night shift workers and those people that are constantly doing overtime work. People who are working multiple gigs. Many families in the country or in the world now are working 2, 3 jobs just to stay afloat because pricing is so high. Um, Also, think about rest for people who are caring for their family, or maybe have a new baby, or caring for older folks who elder care. And then make sure throughout the day you give rest for your brain. Brain breaks aren't just for kids, brain breaks are for everyone who has a brain. One thing I like to highlight with rest is called nature bathing, where you get outside and connect with nature. And just a quick brag, those are two of my flowers. They're called passion flowers. They're really hard to grow in Nebraska. So I have to drag the pots in the winter time and winter them in the house, and then drag the pot back outside for summertime. But they're really, really beautiful. And I know nature bathing helps me to rest and helps me rejuvenate. Studies show that we're spending less than 5 minutes a day in nature, which is wild. And of course, it's not surprising to know we have lost that connection to nature over the last hundreds of years. So let's move to the next category, and that is connection and community. And with this, it's based on social support and belonging, that word belonging that's so important. And I'm sure that's been mentioned in many of the speaking the last few days. Think about your meetings. Are your meetings welcoming and accessible? How about your events? If you have someone who needs special access, or maybe you need to speak through a microphone so people with assisted listening devices can actually hear your words. Are you using inclusive language? And do you have a sense of bias awareness and how some of your words might be excluding to people? I do a lot of work in age inclusion. So, thinking of an age friendly workforce is very important. They have higher retention, they outperform their competition, and so on. But according to research that's been done by many different researchers, longitudinal research, only 8% of organizations globally set metrics around age friendly workplaces and are doing training on age friendly. So that's a piece of inclusion that I'm very passionate about. And this, of course, the culture of inclusion goes back to that first slide I started to talk about with psychological safety, the very first level, welcoming safety, inclusion safety. That's all about being connected. Part of being connected is also having your social capital. I offer a fun workshop called the Connect Effect to counter loneliness, because we know loneliness and isolation is one of the problems that our world is facing. In the United States, when I was growing up, we had a show called Mr. Rogers, and he always said, look for the helpers, right? And when we have pro social behaviors, we know we have more helping behaviors in the workplace and a more welcoming community. Same thing goes with belonging. When you can feel that acceptance and you're valued and heard, that will boost your belonging. And of course, a place where all voices matters. When we say all, we mean all, not just people who look like us or have the same in the same entrance as us, but all identities. So, speaking of identities, when we look at worldwide data from Ernst and Young, 56% of global workers say it's not safe to share specific aspects of their identities at work. More than half are hiding parts of their identity. Back to the Surgeon General who developed this framework, he said that loneliness and isolation is a public health crisis, and lack of social connection correlates with significant health risks and well being risks. And he also attributes this to the tune of smoking 15 cigarettes a day. That is the same health risk that loneliness has, the same health risk as smoking 15 cigarettes every day. And then a few last things on connection and community, thinking about that piece of collaboration that's so important when we talk about social support in the workplace. It is proven that remote workers do not have the same access to promotions, to sponsorship, and to mentorship. And part of this is based on something known as proximity bias. When you're not there physically in the office being seen, sometimes you don't have access to these opportunities. So if you are leading remote workers, please make sure that you are certain to give them access. Research shows the best way to boost belonging is in the power of the check in, truly asking people on your teams, how are you? What do you need? How can I support you? How can I remove barriers? But checking in on people, asking how they're doing. And then the key is being a good listener and listening to their response. All right, let's move on to work-life harmony. We have about 9 minutes left. So like I said, time goes really quickly. This is based on our needs for autonomy and flexibility. So how, when, and where work is done. Do people have some choices on that? And just the thought of everyone has a life beyond work. We're not just robots that work 24/7. One quick example of autonomy. This is a very long story, so I'll shorten it to just about a couple seconds. But employees at Ritz-Carlton have autonomy that they can spend up to $2,000 without having to ask for approval to make something right for a guest. So think about that. How much autonomy does that give people? An incredible amount. So that must feel really good to work there and to be trusted. Research that was done by Deloitte and PwC said that workers born in the 80s to current, when they're looking for an employer, the first thing they want is good work-life harmony and learning opportunities. So learning opportunities, remember that's level 2 of psychological safety, and they want flexibility in their schedule. 75% they say they really would love to have remote or hybrid work. So that's work-life harmony. Leaders, you must model trust. You need to limit your micromanaging, and we don't want to glorify working after hours. So do not expect your workers to respond to messages after work hours. The next category is mattering at work. And this is so important. This is based on our human needs to have dignity and to have meaning in the work that we do. So, how do you have purpose and meaning? The best way is to connect your individual work to your organizational goals. It's beyond having those 5 keywords painted on your walls at work, but you have to think about, how does my work connect to those 5 important words? And do I have pride in the work that I'm doing? Or are you just entering the data, doing the work to be done at 5 o'clock? Or do you have pride in your work? Gratitude is a huge piece. I do full-blown workshops on gratitude. I do believe that gratitude and recognition creates a ripple effect across your organizations. Research shows us that 82% of workers are happier when they're recognized at work. And it's very interesting, when workers are recognized weekly, they're 5 times more likely to stay than those that are not being recognized. And when I talk about recognition, it doesn't have to be a big, full blown, come to the front of the room and receive this trophy, but it can be a note in email saying, thank you for showing up 10 minutes early for all of our meetings. I see you and I appreciate your planning and your preparation. That takes 10 seconds to say that. Maybe it's a handwritten email or a handwritten note that goes out to members on your team saying, I see you, I appreciate you asking questions, whatever it is. But if you can provide some descriptive feedback, that would be really wonderful. But it doesn't have to cost anything and it doesn't take very much time, but yet it can have huge positive ramifications. And then money is a part of mattering at work. We're all working for our salaries. Very few people that I've ever heard of work for free. But are you getting fair wages? Are you getting living wages? Do you have access to the bonus structure? And is there salary transparency at your workplace? So the last category, and we're winding down now on about 5 minutes of time, is opportunity for growth. And this is based on our need for learning and accomplishment. Our career pathways transparent? Another thing to think about is if you get accepted to go to a conference or to get a work certification, sometimes people are told, yes, you may go ahead and pay for that, and we'll reimburse you on the back end. But what we really have to think about is that piece of equity. Many people can't carry those charges over on their credit cards. So reimbursement really is not a fair way to think about opportunities for growth. Organizations need to front that money on the front side when we think of equity. And again, learning, that goes back to psychological safety level 2, and then the piece of who has access to learning. I'm going to share a really startling statistic with you. And this is in the United States. And I know we have people globally on the call, but this is specific to the United States. 94% of our workers that are 40 and older say that ageism is the reason they have limited access to professional development and learning, where people are told, you're going to retire in a few years. Let's let someone else go to the conference. Or you've already gone to the conference twice. Let's let somebody else have a turn. And I could give a lot of examples. Again, a lot of the work I do is in ageism. Sometimes we have the not here bias where we think, we wouldn't do that here. But when you really dive into it and listen to some of the reasons why people are denied access to professional development, you may actually see it in your very own workplaces. Being a great ally helps for opportunities for growth. That's in mentoring and reverse mentoring. Mentoring, of course, is that top down model where the mentor explains everything to the mentee. And reverse mentoring is more of a side by side model where I think you get a bigger bang for your buck, where the mentor mentors the mentee, but the mentee also has very valuable experiences, maybe from college or from a previous workplace, that they can share with their mentor. So, reverse mentoring is a really great thing to think about. Sponsorship, the best person I can refer you to on sponsorship is Rosalind Chow. There's been a lot of articles written. Rosalind has the ABCDs of sponsorship. So if you want to learn more about sponsorship, really in simple terms, it's opening the door for people where they may not have access to rooms or to board meetings or to people, to helping them be seen and their voices be heard. And then, of course, who has access to coaching? When we think about feedback loops, sometimes we're really good about giving feedback from the top down, but not always that feedback loop where people who are individual contributors can give feedback. So we need to think about feedback loops and how does that look? Is that feedback timely and specific and descriptive? This again goes back to psychological safety, levels 3 and 4. Where is it safe for me to speak up and provide feedback? And is it safe for me to challenge the status quo with my feedback? Very interesting research that's been done on some Black medical residents on why they were leaving the programs, as opposed to their to white medical residents, is that they have had lack of specific feedback, less mentoring, and limited access to career progressions. So please, I ask you, if you are leading teams that are culturally diverse, that you make sure, again, everyone has access to these opportunities for growth. And leaders, how are you being coached and how are you being trained? I also have a group of leaders that I call accidental managers. And that would be an example in healthcare. Let's say you are the best IV giver in the entire hospital. But because of those skills, in technical skills, you're advanced to a leader where you may not be such a great leader of people. So, if you have folks in your organization that are accidental managers, how are they being coached and trained? All right, so we're closing out on time. Right now, I'm at 25 minutes exactly, so that's perfect timing. I do want you, like I started with, by saying, what are your action steps? I gave you probably 100 different things to think about. Is there something you can pull from all of this information that makes you think, ah, that's something I can implement? That's something I can take back to my team. I want to say thank you for saying my name, especially in rooms where I am not present. That is an example of sponsorship. So I would appreciate you saying my name to people. And then part of this work too, when we talk about collaboration, is finding a small group you can connect with. I have a group, it's free. It's called Open Office Hours. We get together every Tuesday at 10 o'clock Central Time. Everyone is always invited to jump in. If you want to continue this conversation, that would be a great place for you. And here's all my contact information. So I will stop and pause. I believe we have 4 minutes left if people have questions that they would like to ask.
Yeah, Collins, that was a wonderful session. And yes, there are lots of comments, and that was a very interactive session as well. So there are a couple of questions from the audience. So, what is the key to workplace in well-being? So, it is from Ava Brown.
What is the key to
Key to
workplace
workplace
well-being?
well-being.
Was that
Yeah.
the question? Because I can't see
Yes.
the questions. Okay. Yeah, so all of those pieces, right? Any of those examples that I have given you, um, all of these things, it's my belief that they need to be modeled by leaders. Yes, we can have grassroots, and yes, we can be individuals that come in and want to do great things at our workplace. We still have to have leaders that are modeling these things. So get with your HR people, help them understand why these 5 pieces of the framework are so important and all the specific actions that go under them. Just one example, if you just want to pull reverse mentoring out of our talk today, that would be a great place to start. Mentoring has been researched over many, many years. There's greater job satisfaction, retention, happiness, and so on. But that would just be one small thing you could pull. One piece about my work as well is that I try to work with organizations to look at where are they traumatizing people by things in their handbook or just actions that they do. And that might be glorifying working overtime. Like, why do we do that? People are not going to stay if they're constantly asked to work nights and respond to emails at night. Another quick example, I was working on a volunteer team and they set a deadline for something on Saturday night at midnight. And I said, why are we doing that? Because that just glorifies working on the weekend. And someone said, oh, yeah, we should change it to Sunday night at midnight. And I said, no, 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 that's even worse because then we're asking people to work on Saturday and Sunday. So when I talked them through it, we changed the due date till Friday end of the workday at 5 o'clock p.m. So those are just some examples you can think of what are you doing at work that maybe doesn't fit within this framework. And I know all of the work I do, if it doesn't fit in one of those 5 categories of all of those different pieces that are in the categories, then I believe it's work that isn't important for me to be doing. So I hope that answers your question. If you want to ask and follow up, I'm happy to have a conversation afterwards. But thank you for the question.
Yeah. So thanks for answering the question. So there was another question from Sophia. So what is the one common well-being mistake organizations make?
Yeah, and honestly, I think how I just answered the prior question is when we re-traumatize people through the workplace. Another example that I could give is people who are, let's say I own company X and I have people that are interviewing to come in and work at my company X. And I bring people in, we interview them, we ask them to come back for round two. They think the interview goes really great. And then nothing comes from company X. They're just ghosted. That over time, a lot of my friends that are seeking work have said that has become almost the norm, is they're not getting feedback and or even a rejection, and they're just getting ghosted. So one of my friends put it really well. He said, I don't even want to apply anymore because it's so traumatizing that I never hear back from organizations after I've interviewed round one, round two, round three. So that may be a simple thing that we could fix really quickly, but that we're not getting right.
Yeah. Thanks for asking another question, Shari Collins.
Yeah.
So, so ladies and gentlemen, this is Shari Collins, and so she shared her LinkedIn profile and mobile number and WhatsApp number. So please contact her, and if you have any queries, please reach out to her, and she will be happy to answer all the questions you may have. So thanks for your time, Shari Collins, and have a lovely day. So please be in the backstage and enjoy our next sessions.
Great. Thank you so
Thank
much,
you.
everyone. I'm glad that you're here.
Thank you. Bye.
Bye bye.